Hi, we're a task force for Moldova. Moldova has completed its epidemiological transition as the major causes of death and disability have shifted from communicable causes to non-communicable ones. Cardiovascular disease is the largest contributor to lost DALYs, as it makes up half of Moldova's burden of disease. The second largest contributor is malignant neoplasms, while the third largest is digestive diseases, including liver cirrhosis. Lastly, mental and behavioral disorders are the fourth largest contributor. Among children aged 0 to 4, respiratory diseases, congenital disorders, and neonatal conditions are the main causes of death. Among adult Moldovans, non-communicable diseases are the main cause of death. Cardiovascular diseases are the largest contributor and kill 25% more females than males. Finally, cancer and digestive disease, mainly due to liver cirrhosis, are the other top causes of death.
Cardiovascular diseases is one of the most important public health issues that needs to be focused on right now in Moldova. Cardiovascular disease is the cause of more than 25,000 deaths out of the 43,000 deaths reported in 2012 by WHO reports. That is to say that more than 50% of the deaths were caused by cardiovascular diseases. Even looking at the DALY data, it is seen that almost 35% of the DALYs are lost to cardiovascular diseases, which is the highest by any other disease in Moldova. Here are some risk factors that affect cardiovascular diseases. The very first one is dietary risk. According to WHO reports, it is seen that Moldova has the lowest consumption of fruits and vegetables in the diet. Moreover, it has the highest consumption of cholesterol in the diet. Both of these factors add to the dietary risks, and almost 20% of the DALYs are lost due to dietary risks. The second most important risk factor that affects cardiovascular diseases is overweight and obesity. According to the WHO reports, it is seen that right now 50% of the population is overweight and 22% of the population is obese. That is to say that it causes almost 8% of the DALYs lost to cardiovascular disease. This can be attributed to 60% of the adult population being inactive.
Substance abuse is another major health issue in Moldova. Alcohol causes liver cirrhosis, and both alcohol and tobacco cause various types of cancers. This is due to easy availability of the substances and lack of education. Moldova is one of the largest producers and exporters of liquor and has become the biggest alcohol consumer in Europe. Tobacco industries are successfully targeting women by using softer and safer messages on ads and having scented and attractive packaging on tobacco products, thus significantly increasing the number of female smokers as compared to male smokers. Although the literacy level in Moldova has reached 99% in 2012, there are still almost 20% of children out of school. Lack of knowledge of harmful effects of tobacco and alcohol is one of the top contributing risk factors for substance abuse.
Mental and behavioral disorders are one of the most ignored of the public health issues, even though the DALYs lost to this are significant. In Moldova, only 4% of the medical expenditure is dedicated to mental health services. Within this, most of the resources are distributed to mental hospitals, therefore only effectively treating those with severe cases. Those with milder conditions that require outpatient care may be unable to seek help and have their conditions ignored and eventually get worse. Economic instability is a major risk factor contributing to mental distress. Poor income status, as well as being of lower social and economic status, put people at a disadvantage because they may not be able to afford medical care. The Eurozone debt crisis of 2009 has also played a role in mental health instability among Moldovans.
We have organized intervention plans for these three public health issues. Unhealthy diets and physical activity are the most immediate issues to deal with for cardiac problems. For children, we will introduce mandatory PE and sports programs in schools and hire nutritionists to plan out healthy school lunches. The immediate intervention for adults is to have well-equipped sports facilities at easy access locations. Free and low-cost physical activity workshops will also be provided. To reduce alcohol consumption, we will increase taxes on liquor by 25% and increase the legal drinking age from 18 to 21. Also, we will launch an anti-substance abuse campaign consisting of posters in public areas and on-ground volunteers assigned to distribute pamphlets and answer questions from the public. To deal with the women-biased tobacco ads, we will heavily fine the tobacco companies that have biased ads.
In order to improve the mental health, the very first step is to redistribute the sources from hospital care to outpatient care. Outpatient care would include counseling, an anonymous phone line, and support groups. So we as a task force believe that if these interventions are followed, this will greatly improve the lifestyle of people of Moldova. Thank you.